So we received many questions from folks wondering what the considerations are for those people who may be living with viral hepatitis or at risk of viral hepatitis in light of the COVID-19 coronavirus pandemic. So today I'm thrilled to invite Dr. Gish on the line to answer some of the questions that we've heard from some of you. So thanks so much for being here, Dr. Gish.
Lauren, thanks for setting this up, and I want to thank you and Michael and the rest of your team for having me part of NVHR. Very honored.
Great. Dr. Gish, do you mind giving some folks some background about your clinical experience?
All right. I'm based in San Diego. San Diego's been one of the hot spots in the United States for both liver disease and for COVID-19, as you know, also called SARS-CoV-2. For a couple of reasons. One, San Diego is a place of a huge immigrant population, so we have a lot of hepatitis B. We have high-risk populations for hepatitis C, high-risk patients for NASH and alcoholic liver disease. On the other hand, as you know, many of the patients from Wuhan were flown into San Diego and quarantined here, and a number of the individuals from the ship that docked in Oakland were also moved to San Diego. So we have been a repository to provide high-level care because of expertise here in the Department of Public Health and also at UCSD and the other institutions in the community, which has been exemplary. So that's some background on both liver disease and also COVID-2 that we have here, the SARS-CoV-2 or COVID-19. I work at La Maestra, which is a federally qualified health center, and I've been actively working at that clinic, managing the risks for COVID-19, and also have been at least audibly participating in the Department of Health alerts that took place. There was a 2-hour seminar last night for the San Diego Department of Health and how they were managing this respiratory virus in San Diego.
Great. Thank you so much for all that you're doing on the front lines of the response to those viral hepatitis epidemics and now COVID. So I'll go ahead and dive right into some questions. And for folks that are viewing this at a later date, just so you know, we've recorded this on March 18th, 2020. So these responses will be kind of based on our best knowledge up to this point. But of course, this epidemic is rapidly evolving. So I'll just preface it with that. So Dr. Gish, just broadly speaking, are there special concerns for people that currently have a form of viral hepatitis, or for the people that perhaps maybe don't have viral hepatitis but live with someone or care for someone who has viral hepatitis?
Well, first off, you'll be covering all the special precautions and warning signs of this coronavirus infection separately. So I'm going to really focus here on viral hepatitis, which is, of course, ABC. Everybody needs to know their ABCs, needs to know if they're immune to hepatitis A and vaccinated, if not hepatitis A immune. Their hepatitis B status, there's 3 tests that people need to know, and it's surface antigen positive. Those patients need to be staged for the level of their liver injury or liver damage. Same thing for hepatitis C. All hepatitis C patients who are antibody positive need to be tested for hepatitis C RNA positive. They're hepatitis C actively infected and also need to be staged. So this is very important because patients who have chronic B and chronic C without cirrhosis basically need to take the standard precautions for this coronavirus infection. If patients have cirrhosis, because the coronavirus does affect liver inflammation, does affect liver enzymes, and could also cause liver dysfunction. There's been one significant publication on that we should make available. Those individuals would be at higher risk of liver disease progression and decompensation. For individuals that live with someone who has viral hepatitis, of course, they need to take all these special precautions, which are standard for the coronavirus. If somebody has viral B or C and cirrhosis, extra special precautions with probably heightened monitoring with liver enzymes monthly. And of course, if they develop the coronavirus infection, very close monitoring of liver enzymes and liver function. Just to remind everyone, ALT and AST are not liver function tests. These are liver enzymes that indicate liver inflammation. The best liver function test is the bilirubin test, but also there's a coagulation test called INR and albumin. Those 3 are our defined liver function tests and need to be followed in individuals with high enzymes, people who develop coronavirus infections, monitoring for liver inflammation and liver dysfunction.
Great. Thank you so much. That's helpful to know the importance of staging and sort of level of liver damage in light of these considerations. So if you're someone who's living with hepatitis B or C and you haven't yet started treatment, maybe you wanted to, but then COVID hit, should you still follow through with your doctor and start treatment, or does it make sense to wait until COVID has passed before you go ahead and get started on treatment?
I'm advising active initiation of B or C treatment if the local provider has recommended treatment. So hepatitis B, of course, there's multiple strata of individuals, some of whom may not need immediate treatment. Of course, if somebody has hepatitis B and cirrhosis, they should be on hepatitis B treatment, irregardless of their HBV DNA level or number. Hepatitis C, I'm actively treating people in clinic. Even this week, we brought in a person who is very anxious about their hepatitis C to start them on DAA therapy, and we'll be initiating that as soon as we can get insurance approval. There's no reason to wait for COVID to pass.
Okay, great. So along those lines, some people have wondered if the treatments themselves for hepatitis B and C could somehow make people more immunocompromised or make them more vulnerable to complications from COVID?
Simple answer, no. B and C infections don't necessarily compromise the immune system unless somebody has cirrhosis. And if they have complications from COVID-19, they will not be made worse by hepatitis B or C treatment. These actually would help protect the liver and potentially decrease the risks of COVID-19 complications.
Great. Well, that's really good to know. Along those same lines, people have said, if I started treatment, should I go ahead and continue it? And in some cases, insurance plans might require people who are doing DAA therapy for hepatitis C meds to go out and get a blood draw. We've heard from folks that are worried about sort of potential exposure and wondering if it's worth it to continue on with their treatment or not. Do you have any thoughts about that for folks that may be midway through treatment?
Continue your treatment. There's no reason to stop hepatitis B or hepatitis C treatment. Continue laboratory monitoring as per your provider. I'd like to point people to the new AASLD simple guidelines for hepatitis C treatment that does not require the frequent blood monitoring that we did before. So look at those simple guidelines. It's really lowered the bar for us. I'm very happy with how they're set up.
Great, wonderful. What should people do if they have hepatitis B or C and they develop symptoms of COVID?
They should immediately contact their provider. There are very special protocols in place for testing for COVID now. Testing availability is slowly improving each day. There's a screening questionnaire for individuals for testing. Follow those CDC guidelines which are being passed down to departments of health throughout the United States.
Great. And I guess a follow-up to this, you mentioned that someone who has cirrhosis really needs to be closely monitored. So if they're tested in the setting of an emergency department or urgent care center, does it make sense to loop in, if they've got a hepatologist or someone kind of tracking their liver damage, to loop in that specialist, or is that something that will naturally be managed?
Well, I would state that the standard of care for COVID patients is to monitor blood chemistries, because there's all sorts of other things that can change in terms of CBC with lymphopenia. White count can go high or low, and there's a number of other metabolic abnormalities that can take place. So liver tests should be part of that monitoring, and then if the liver tests increase, then a liver GI specialist should step in.
Okay, great. Another question we've had is for folks that may have had a liver transplant because of viral hepatitis. Are there any considerations for those folks who may be on immunosuppressants?
Yes, so all patients with immune suppression from a variety of things, could be chemotherapy, they may have autoimmune diseases, they may have liver transplants which require anti-rejection medicines. They're considered immune suppressed, and those patients are at higher risk for complications from this coronavirus infection. There's quite a bit of data that's been flowing out through our American Society for Transplant, AST, blog that's been going on. I've probably looked at over 150 emails from people around the world on how they're managing individuals in China and Italy, the two of the countries that are the hardest hit Iran's also been hard hit, but we don't have much correspondence with them, unfortunately, about how they're managing their transplant patients. But typically what's happened is gently the immune suppression may be lowered slightly. It's also quite clear from my interpretation is that patients should not be on steroids or given steroid boluses just because they have a coronavirus infection that can make the coronavirus worse. There is a controversy out there about managing fever and pain. Acetaminophen is preferred, but the data on ibuprofen or NSAIDs worsening coronavirus is quite controversial, and I would not depend on those specific statements yet from certain countries in Europe about the risk of ibuprofen. But acetaminophen is extremely safe in patients even with cirrhosis, up to 2 to 3 grams per day for managing pain and fever. So that should be step one. Non-steroidals should be as per local provider's discretion.
Great. Well, thank you so much. I think that answers all the questions that we've been hearing from folks who are living with viral hepatitis, but I want to encourage anyone, if there's questions that we didn't get to today, feel free to email us at info@nvhr.org, and we can refer your questions to Dr. Gish or anyone else that may be able to answer them. Dr. Gish, thank you so much for being on today and answering these questions for everyone amidst this time when there's a good bit of concern and fear among our community. And I think you've done a great job of outlining specific steps that folks can take and precautions as well. And so thank you so much.
Appreciate being here. Everybody wash your hands and stay 6 feet away. Use masks if you think you're infected or are infected. Thanks so much.
Great, thank you.